Hello and good morning and
Hello.
welcome. Today I have a very special guest with me, Dr. Ranjini. She's an Ayurvedic practitioner from Kerala, India, which is one of the best places known for its Ayurvedic heritage. She holds her BMS degree in Masters in R&B and has lots of experience. And her, I would say, mm, can you say major topics is not only the lifestyle disorders, it's also stress, it's also women's health, it's gut health and nutrition. Did I forgot anything, Dr. Ranjini?
No, Anya. And thank you. Thank you for the lovely introduction. And I'm happy to be a part of this. And I would like to thank ASHAexperience for this opportunity.
Yeah, thank you so much for having you here. And today we are talking about mental well-being, like how to manage the stress and navigate through tough times. In your opinion, what is the most common sign of stress, like out of the Ayurvedic perspective? And how can individuals identify them early?
Yeah. So before answering your question, allow me a few minutes to explain what stress is. So it's something we hear often these days, right?
Mm,
So stress is a feeling of emotional and physical tension. It is experienced when the body responds to any kind of excessive demands, I would say. And it can be induced by physical factors, mental factors, environmental, and social factors. So, as far as the body is able to tackle it or cope up with it, it acts as a normal stimulus, which in fact is required for our well being, and it is known as positive stress. On the other hand, it becomes negative stress or distress when the person is not able to tackle it or cope up with it. So, the difficult thing about stress is recognizing it. Doing something about it is rather easy, I would say. And coming to a question, the common signs of stress in an Ayurvedic perspective. So, we know the stress can have many ill effects on our body. And some of the common symptoms are chest tightness, palpitation, increased sweating, that's profuse sweating, perspiration, and muscle aches, especially shoulder pain, neck pain, and difficulty falling asleep, that is insomnia. And stress also has effect on our immunity and digestive health. And it also decreases our libido actually. So the symptoms of stress varies from physical to digestive to sexual health actually. And it never comes to our mind that indigestion or lower libido can be a symptom of stress. Now, let's look at these symptoms in an Ayurvedic perspective. In Ayurveda, we have a unique concept called Prakriti. So, a person is born with a certain Prakriti, and there are total seven different Prakritis explained in Ayurveda. So, Prakriti is permutation and combination of the three doshas we have, that is Vata, Pitta, and Kapha. And majority of the individuals will be having dual dosha Prakriti, that is either Vata Pitta Prakriti or Pitta Kapha Prakriti or Vada Kapha Prakriti. So, all these individuals reacting to stress would be different and they'll be having different symptoms as well. So, to put it into perspective, a stressed Vata individual often experiences anxiety, insomnia, restlessness, palpitation, and erratic appetite. Coming to a stressed Pitta individual, he will show anger, frustration, and profuse sweating, perspiration, etc. They might also experience heartburn, loose stools or diarrhea, and a tendency towards perfectionism. And a kapha predominant individuals under stress may become lethargic, emotionally withdrawn, and prone to overeating. So, this is how we can analyze the signs of stress Ayurvedically. Now, coming to the second part of the question, that is to identify stress early. So, Ayurveda encourages self awareness, that is, monitoring the changes within ourselves, that is, our mental clarity, our emotional stability, and our physical energy. Ayurveda advises to analyze our body as a part of our dinacharya or daily routine. So some days we feel like we are not doing good. We are not able to focus on our work. We are not able to eat properly. We are not able to sleep. So that certain days are like that. So it might feel like these are trivial symptoms or trivial things. We usually ignore it. So, but I think we need to pay attention to these signs actually. Our body is trying to tell us something. But if we have some physical pain or cut on our body, we we will take rest or consult a doctor or take medication, right? So the same thing happens to our mind also. So always listen to what our body is trying to say to us. And I hope that answers your question.
It actually does answer my question, which leads me already to the next question. Like, I mean, Ayurveda has a totally different approach to, in general, to stress, but because just from the perspective looking at the human being holistically, what is the difference compared to the modern medicine?
So the one of the main objective of Ayurveda is the maintenance of health of a healthy individual, other than the curative aspect. So it is the preventive aspect. So there are two approaches to prevent stress. One is to avoid stressors, that is the factors that induce stress. So the second is to increase the coping capacity of our body.
Mhm.
So Ayurveda says sahasam sada varjayet. So that means one should always avoid overexertion. But in today's competitive world, I don't think it's something easy to follow, right? So we are going to the second step. The coping capacity of the body can be increased by lifestyle modification, dietary intervention, and obviously with medications. So here comes the importance of Rasayana. So Rasayana is one among the 8 branches of Ayurveda. So in Rasayana, it includes dietary modification, uh, lifestyle modification, like following a code of conduct actually. It is known as Acharya Rasayana. So Ajay Rasayana constitutes the balanced use of sense organs, following non-violence, and having a control over emotions. And another important use of Rasayana is the modulation of immune system. So chronic stress can have immunosuppressant action and can lead to several diseases we know, like hypertension, diabetes, obesity, like that. So unlike modern medicine, which primarily focuses on the symptomatic treatment, Ayurveda tries to balance the dosha, both the physical and mental doshas, and restore that equilibrium. And the treatment will be based on individuals' prakriti and dosha rather than one fits all solution, one size fits all solution. So if the person is having more pitta like symptoms, we can give pitta reducing medications like guduchi. And we can go for panchakarma like virejana, which reduces the pitta dosha. We
What
can
is the
also suggest
what is Guduchi for people who
guduchi
don't
is okay. It is a drug, and the scientific name is Stenospora cordifolia.
know? Okay.
Yeah. So it is good for pitta to reduce the pitta dosha. So
Okay.
if the patient is having more pitta symptoms, we can go for that kind of drugs. And we can also suggest diet according to the patient's dosha condition. And we can always incorporate practices like yoga, meditation, pranayama. And in these aspects, Ayurveda stands out.
Definitely. So I understood already that we have a very individual role of constitution because every person has different doshas, different imbalances, and
Yes.
but how to personalize it now? Because stress management is a huge topic, and also Ayurveda, the treatments are very personalized. Like,
Yes.
how is it like if we go a little bit deeper, how different is it for each dosha then? Like let's say you have a Vata Kapha imbalance, or like, or is there a significant match you can notice from each dosha that you noticed in modern times, like pretty much everyone has, no matter which dosha they have? Or is it really
Okay.
totally unique for every person?
So, as I said earlier, we have a personal approach.
Mhm.
So, I have already explained about Prakriti, right?
Yes.
So it is a natural constitution of an individual and it is unique to each person and
Yes.
is fixed at the time of the birth.
Yes.
It's fixed, and as the age progresses, there may be some variations. So, as I have explained, there are 7 different Prakritis, and if a person is having Vata Kapha Prakriti,
Hmm.
the if he's under stress, the chances of him having uh, symptoms of Vata and Kapha will be more,
Hmm.
and the Pitta will be less. So we have to address that Vata and Kapha,
Hmm.
and we will select the drugs according to that only.
So how do you
Is
decide which Prakriti you choose first? Let's say someone is having not only a emotional disorder, he also has stress, high amount of stress. Like which symptom you focus first?
So,
Or
signs of stresses are different. Like
yes.
they have physical stress, they have emotional symptoms, and they have psychological symptoms as well. And Ayurveda has explained the presence of dosha in each of these symptoms. So, if the person is having anxiety,
Hmm.
it's an attribute of Vata.
Hmm.
So we can identify Vata there.
Hmm.
And if the person is having less appetite, so
Hmm.
we can say, okay, there is Pitta.
Hmm.
And if he's having more activity, he's hyperactive, then we can identify Vata. So Ayurveda has beautifully explained the symptoms according to the dosha. So actually, it is easy for an Ayurvedic doctor to identify the dosha. Then it's we have to select the drugs accordingly, and we have to tell the patient, you have this prakriti and you have this dosha now, and you have to take this, these are the diet you have to take, and these are the medicine that you can take to bring that doshas back to your normal prakriti. That's how we work.
So you basically decide what is better to start with because like let's say you start first with the emotional, of course, which is probably better to start with, and then go to the physical stress because I recognize that so many people or clients come and they have so many symptoms and so many
Yes.
imbalances that you're like, okay, where do we start first? Because you cannot cure everything at the same time.
Yes. So, first we try to identify the acne, that is the digestive fire, because in Ayurveda we say sarve rogo api mande akno. Mande akno means the digestive fire is less.
Mhm.
So, if you are to give the medicine first, they should have the digestive fire to at least digest the medicines, right?
Yes,
So
yes.
we start from there because, and the researchers now proves that because gut health is very important. Gut mind axis, even gut skin axis is there. So on all this is we start from gut.
At the moment, so many talk about cortisol levels. I love it because is there a specific herb or treatment in Ayurveda where you basically can say, okay, this reduces my cortisol level and is also calming down my nervous system?
So yeah, there are several Ayurvedic herbs that are renowned for their adaptogenic and nervous system calming properties, and thereby regulate the cortisol levels and alleviate stress. To mention a few, I have already mentioned Guduji, right? It is Tinospora cordifolia.
Mm-hmm.
So Guduji is proven to have antioxidant properties and anxiolytic properties, which helps in stress, of course, and it promotes immunity and it promotes acne also. So when we give a medicine, we don't give medicine to just stress only.
Mm-hmm.
We totally see that person as a whole. That is our holistic approach. So when we give a medicine, we have enough medicine, so we will select like so this person have some acne problem, his pitta is high and he have this problem, so this medicine is very suitable for that person. That's how we select. And to mention other few, ashwagandha is very famous now. It is Withania somnifera. So consuming ashwagandha in the right dosage and for a right duration can help regulate cortisol levels, pacify vada dosha, and ensure overall well-being. And there are several other drugs like Brahmi and Jadamamsi and Tagara and yeah, and Shankhapushpi. Yeah, these are some of the medicine that comes to my mind right now. And all these have anxiolytic properties, and they are very much used in the stress management. And to mention few treatment modalities, Ayurveda treatments such as Abhyanga, that is body massage with oil, and Nasya and Shirodhara, and practices like yoga, pranayama are useful here. I will try to explain about a few like Abhyanga. Abhyanga is body massage with oils.
Mhm.
And we can select the oil according to the patient condition and according to the climate also. Uh, if it is summer, it is better to select coconut oil because it is having a cooling property. Coming to fall or winter, it's better to select sesame oil and it has more warmth. So that's how we can select different oils in Abhyanga. And there are specific oils that can be used on our scalp also. And there's a specific treatment modality called Talam. Talam is a Malayalam word, which is my mother tongue, where I come from, Kerala. So Talam means applying medicine on our head. There's a region called Brekma here. So there's a shallow depression and we apply medicine over there. And it's a wonderful treatment modality, and we use Talam in stress management. And there is something called Nasya. Nasya is Nasa is known as our nose. So
Mhm.
nose in Ayurveda is the gateway to the head.
Mhm.
So whatever problems we have here, we give medicine through our nose. We can select powders, oils. We have different medications, and it helps relieve stress, promote sleep, and have a good sense of a good clarity of sense of the sense organs. And it is good in certain other conditions like allergic rhinitis, etc. And Shirodhara. Shirodhara is the administration of thyla on our forehead. And it is again an excellent choice in stress management. And we can also use takra instead of oil in case of Shirodhara. Then it becomes takradhara. Takra is nothing but buttermilk. And
Oh,
here in takradhara, yeah, in takradhara we use medicated takra, not just plain takra. We use medicated takra according to the patient's condition. So there are different herbs and treatment modalities that are available in Ayurveda for stress management.
yeah, but let's say I'm not having the whole clinic at my place, so I just have basically a few options and maybe just wanted to jump in. What would be daily practices or routines to actually put myself back into the resilience during tough times? Like you mentioned daily routine, like how about
Yes,
the
yes.
Nasya? I know that you have like how they put like water into the nose.
That is something different. That is a
Ah,
part of yoga called neti. This,
Nitis.
yes, yes, this is different. This is nasya. So, Ayurveda mentions daily practices like dinacharya,
Mhm.
and there is something called riducharyas.
Mhm.
Ritu means season,
Mhm.
and the practices we have to follow according to the season. So
Mhm.
we have dinacharya and riducharya, and these are mentioned to build physical and emotional resilience. So, in the benefits of dinacharya includes the regulation of our biological clock. We have a biological clock, and then rejuvenation of tissues, then strengthening of our sense organs, and restoration of mental peace and harmony. And the first one explained is in dinacharya is waking up in Brahma Muhurta, that is waking up with sunrise or before sunrise, like 45 minutes or 30 minutes before sunrise. So the researchers have showed that cortisol is at its peak in 30 minutes after post awakening in Brahma Muhurta. So it carries anti-stress. We know cortisol carries anti-stress activity, immune modulation, and metabolic enhancement. So you should also have a good ratri charya. Ratri is night. So you should have your dinner early, maybe a light dinner early, and avoid exposure to noise, light, our gadgets like our phone. And after waking up, you can do an analysis of your body by yourself. You can analyze what all things are going through our head, our body, like that. Or you can start the day with meditation or pranayama. Like simple pranayama you can follow is Nadi Shuddhi pranayama. That is inhaling through one nostril and exhaling through the other. That is simple. Anyone can follow it. And it helps to balance the mind, reduces the stress, and improves our mental clarity. And Dinacharya also helps to utilize our daily time to plan ahead so that there won't be anything that induces our stress. So that is a good thing to do. And we can follow Abhyanga. Abhyanga, you don't have to, like massage for like all 30 minutes. You can just take any oil, as I have mentioned, any coconut oil or sesame oil. You can take it in your hands and rub it and then apply on your body, like for 10 minutes or 15 minutes just before your bath. So then you can pacify the Vata, which is the main culprit behind stress. So Abhyanga you can follow as part of your Dinacharya. And Nasya you can also follow. It is Nasya these days, the medicines are available in dropper bottles. So you can instill 2 drops of the oil in one nostril and 2 drops in the other nostril. It is something we can easily follow. And it also helps to alleviate stress, and it's a good thing. And the usual thailam we use is Anu thailam. And it is very much available online. And yeah, and instead of having normal tea or coffee, you can have herbal teas. And Shanghu Pushpi, that is blue pea, it is known as blue pea, and it is very famous these days, blue pea tea. It's very nice to see, like a purple color. So we can have blue pea tea instead of a normal tea or coffee. So creative, consistent routine is essential in Ayurveda. And regularity in meals, sleep, and self-care practices help to build a balanced mental state.
You mentioned the massage. Like, let's say I would choose for massage in the morning and in the evening. Why do I? Because I know a lot of our friends, they normally take first their bath and then massage. But you mentioned make first the massage, then have the bath. What is the reason?
So in Abhyanga, we use oil, right?
Yes.
So yeah, it's so we have to warm the oil and then apply it to all our body.
Yes.
So by practicality, it's better to wash your body after the massage, and you can keep the oil for like 10 to 15 minutes. So what I do is I apply some oil on my body and I try to do my stretching exercises. So there will be that oil on our body for like 10 to 20 or 30 minutes. Then after resting for 5 minutes, I do my bath. So that's how I usually do that.
No, it's interesting to know because everything, as you say, it has a totally different approach when you start reflecting on your routines and what it actually
Yes, yes.
does to your body. And that's even, as you said, it's an awareness. And people always, they just take something and apply it for them without actually proving if that makes sense to them or how it feels. And I think that is also a very powerful tool from Ayurveda to actually self-reflect, like, how do I feel with it? How do I sit with it? What does it do to me? Because I have noticed for myself, sometimes I'm so emotional that I can't have massage because it makes me kind of crazy. So I don't want to be touched even by myself. So then I just sit in the bath, having a longer bath, and then start in my daily routines.
So yeah, as part of Dinacharya, we have to do our self-analysis, right? So
Exactly.
certain days we don't feel like it. So that's again our body is trying to say you don't have. I don't feel like doing it. So even we don't have to wake up early if in the former day we had our dinner late. So there can be chances of indigestion. So we don't have to get up early that day. So that's our decision. So that's the intention of self-analysis in Dinacharya.
Yeah, but that's also important to say because some people they already start by getting stressed out because they think I have to do it all like that and I have to do it in a perfectional way. And this is the only way where I always say, no, we just give an idea. It's like a buffet and you take what feels right for you.
Yes.
That's what people always forget. Um, Related to the mindfulness and everything we have today, people are doing yoga and people are doing pranayama into the modern um, society and in the modern lifestyle. What is for you the best practice to really calm down your mind?
Yeah. So the idea of mindfulness is to bring your mind back to the present at all times.
Yes.
And you can start this small. Just try to notice when your mind is trying to run away.
Mm.
You can just self analyze it. So you can start mini meditation, like even a few minutes of mindful breathing can help relax the mind and body. Like, and you can also practice nadi shuddhi pranayama, and it can be done in between your meetings or during your short breaks in your office to reduce stress. And one thing you can easily practice is mindful eating. I always tell that to my patients. Like in Ayurveda, the Agni or the digestive fire is of great importance. So every disease starts from this distorted digestive fire. So try to eat without distraction. Try to eat not too fast, not while scrolling down through your phone, and just savoring the food mindfully,
Mm.
and choosing the meals that align with your dosha. That you can only select when you consult an Ayurvedic doctor. They will suggest you the diet according to your Prakriti and your dosha. And you can also do gratitude journaling. That's something I love. Like instead of scrolling through your mobile, take some time, like in your evening or just before you sleep, take some time to write about your day, like things you have learned, or things you felt happy for, and people you are grateful for in your life. So by incorporating these small but potent practices into your dinacharya, you can bring balance and mindfulness even into your busiest schedules.
Thank you so much, Dr. Ranjini. Yeah, the journaling helps a lot, honestly, because I was the most known person for overthinking everything, but basically my mind was already running to hell, and I tried them all, like meditating, but I was a perfectionist, so I was always trying so hard. And the more I let go, and the more I said, okay, what is best for me? The better it works. Honestly, it's not about what you read out there and you take it and you just implement it by not thinking about it. As you said, it's about the whole reflection and the whole, yeah, alignment of your inner self and everything.
Yes, yes,
Yeah. Any
exactly.
anything else which comes into your mind regarding stress management where you say, oh no, that's definitely something we forgot about to talk, or think something you still want to mention?
So when I mentioned about the personal approach, I uh, try to explain about the Prakriti. So I have seen in this online platforms, like they are trying to assess your dosha. So that's something different. So I would like to take this opportunity to
Yes, please.
mention about that. So Prakriti and dosha are different. As I mentioned, Prakriti is something that fixed at the time of your birth.
Yes.
And as the age progresses, there might be some changes according to different factors like physical, mental, or environmental factors. And there are seven prakritis according to the doshas, like Vata prakriti, Pitta prakriti, and Kapha prakriti. It is single dosha prakriti. And there are dual dosha prakriti, Vata Pitta prakriti, Pitta Kapha, and Vata Kapha. And the seventh one is like combining all this, Vata Pitta Kapha prakriti. And the Tridosha Prakriti is like more ideal. We don't really see it very often. And majority of the individuals will be having dual dosha Prakriti.
Mm.
So I would like to explain the stress management under this perspective. So the capacity to handle stress will be different to different Prakritis.
Mhm, mhm,
For example, people with kapha dominance, they're mentally strong people. They're patient, they're tolerant, they're hardworking nature. So it makes them confident to handle the stressful situation, the difficult situation. Therefore, kapha predominant prakriti individuals can handle stress very well. So that's the difference. That there lies the difference. And they have good sleeping patterns as well. So they already have a calm mind. So it's easy for them to navigate through the situation. And coming to the Pitta dosha people, they're fearless, they're brave and intelligent, and their intelligence and bravery give them the confidence to handle these situations. And Vada predominant people, they have unstable thoughts. They'll be like multitasking, so many thoughts at the same time in their mind, and they easily get irritated. So stress handling will be a little difficult for them. So, with the help of correct Prakriti analysis, we can avoid stress induced diseases. So, it will be different for different Prakriti people. And coming to the treatment aspect, let's take a patient. Let's assume he or she is having Vata Pitta predominant Prakriti. So, Vata Pitta predominant means Vata is high, because I mentioned Vata first. So, Vata is high, then Pitta, and Kapha will be very less, not to even mention. So, if he gets affected by stress, the chances of him getting more Vata symptoms are high, because already in his Prakriti, Vata is on the higher side. So, the symptoms will be more like anxiety, restlessness, and insomnia. And he will also have some pitta symptoms, because there is pitta in his prakriti as well. So, like irritability, anger issues, loose stool, something like that. And see, that's how it works. So, even though the patients will be having the same stress, the symptoms they will be showing will be different. And here we can go for the Vata Pitta reducing treatment, as I have mentioned, like Guduji or Virejana Panchakarma to reduce the Pitta, and Abhyanga, Shirodhara, and the medications for that dosha. So this is how Ayurveda personalizes the treatment according to the Prakriti and the dosha. So yeah, that's I wanted to mention here.
Thank you so much for that. That makes the whole thing round, especially like, yeah, to create that awareness, we have to talk over and over again. Thank you so much for having you, taking the time with ASHAexperience, Dr. Ranjini. And yeah, it's been a pleasure to keep continuing working with you and do more interviews like that.
Yeah, sure. Thank you. Thank you so much, Anya. And you have been a wonderful interviewer. Thank you.